Good evening and welcome to For the Record. For the last 16 years, the world has been celebrating National Breast Cancer Awareness Month, also known as Pinktober. Pinktober is a month-long awareness campaign on risks, early detection, and prevention of breast cancer. Joining me this evening to discuss this month's awareness campaign in Fiji is Dr. Bahashrat Munshi, Consultant General Surgeon at Suva CWM Hospital, Belinda Chan, the CEO of the Fiji Cancer Society, and Marianne Blakelock Wong Lee, a breast cancer survivor. Welcome to the show, and thank you for joining me this evening. Let's start, shall we? Dr. Munshi, my first question is to you. What is cancer?
What is cancer? That's a very good question. So cancer is a very broad term which encompasses a broad range of disorders, which is characterized by normal cells transforming into abnormal cells and basically starting to invade the body. Basically, you could probably view it as being parasitic to the body. Now, cancer can start anywhere in the body, so pretty much from the top, like the head, right down to, say, your toes. So it can affect any part of the body.
And why is it important to raise awareness of breast cancer on this particular month? Belinda?
It's important to raise awareness because here in Fiji we have women who are coming in late. Breast cancer can, if detected early, be treated, and we'd like to ensure that with all our awareness programs that's happening at the moment, through word of mouth, you can actually take the message that we provide and pass on to other people. So it should not stop for the month of October. It should continue for the remaining 11 months.
So it's just a month that was picked out to not only raise awareness, but to get women more involved?
Yes.
And apart from breast cancer, what are the common types of cancer that can be found in Fiji?
Well, I guess you could look at it and divide it according to the various sexes. So in women, breast cancer is definitely number one.
In the country, yeah?
In the country, yep. And the other common, or another common cancer is cervical cancer. Then there are other cancers in women such as ovarian cancers, you can have lung cancers, pretty much anywhere in the body, thyroid cancers, etc. Now men, prostate cancer, that's fairly common in males. And then some other common ones are lung cancer.
But if you were to put out, let's say, top three, what would they be?
Top three for, yeah, so I would say top three cancers, lung cancer, breast cancer, and definitely prostate cancer is up there.
And how long has the Fiji Cancer Society been running this Pink Ribbon campaign in Fiji?
It's been a while, but for me, this is my third year.
Your third year with the organization.
Yes.
And why the color pink?
Well, pink is considered the quintessential female color, and American studies on the color pink have noted that it has a very calming and playful effect. Pink can also be considered health-giving and life-affirming, so hence the color pink is everything that cancer is not.
And what has been some of the impacts with this particular campaign?
Well, I'm hoping that there is an increase of women turning up to the hospital for treatment or for tests. Women who know that they do have that lump, that they're actually presenting themselves now to get themselves tested.
And has it been effective in raising awareness?
I think it has. We have been very effective. That'll probably reflect at the clinics which Dr. Basharat and his colleagues have at the CWM.
And how have you measured the impact of this campaign? What are some of the numbers that you have?
I don't have any numbers.
Okay, I'll ask them.
Maybe Dr. Bash would be able to give you a fair idea as to where.
Yeah,
I guess you can measure the impact of these campaigns, as Belinda was alluding to, is the fact that more and more women are now showing up to our clinics. Now, and the good thing is that it's not necessarily all breast cancer related things that they're showing up with. Certainly related to breast issues, more and more women are getting or seeking medical attention because they have a lump in their breast, because they might have an abnormal discharge from the breast, or if their skin doesn't appear to be the right color. So yes, that's one of the sensitive markers. The other thing I guess you could say is that in terms of breast cancer itself, we are diagnosing more, meaning it's probably always been there. Now that the women are coming through our door, we're actually diagnosing them. So that's another very good indicator that women are, that these campaigns are working. And not only that, I think the more reassuring thing I think is that traditionally we used to see very advanced form of breast cancer, so like the stage 4, which unfortunately is not treatable. This is cancer that has traveled outside of the breast, say to, for example, to the lung, and unfortunately in this situation is not able to be cured. I can say anecdotally that we are getting, although yes, we are seeing lots of metastatic cancer still, but we are certainly seeing cancers in the more treatable stages, and women are definitely presenting slightly earlier, which is reassuring.
So, like in a year, how many women would you say would come in for screening?
So, I mean, that would be figures from the clinics, and on average, I'll just say we run a breast clinic once a week,
Yeah.
and the average numbers through that clinic would be between 35 to 40 women. So you can do the math, multiplied by, we don't have probably clinics running for a couple of weeks of the year during the holiday and festive season, but for most of the months or weeks of the year, we have on average 35 to 40 women coming through these clinics. So that's a big number when you do the mathematics.
And these clinics, they go out to the rural communities, go to the outer islands, do they?
These are specialist clinics that I'm talking about, and this is conducted at the Colonial War Memorial Hospital in Suva. And that's a very good point you've raised there, because for every patient that we see with a breast problem,
Yeah.
there's probably 3 or 4 more out there with a problem that we are not seeing. In saying that, I'm thankful that we've got a relatively mature health system whereby we have health centers, we have nursing stations even, not only around the country in the main islands, but in the little islands as well. So women would then turn up to these little clinics, are identified potentially as having breast issues, and then they are referred over to us on the main center in CWM. And this is where we sort out what exactly these women have in terms of their pathology.
And is this where the Fiji Cancer Society come in as well, in terms of raising awareness through the grassroots levels in the communities or within the outer islands?
Yes, we for now it's just focused here on the mainland, here in
Mainland.
Fiji level, with a very supportive Western group that do awareness in the West. And for us here in Suva, the awareness we do is we talk about what we do, and we also take a survivor to talk about their journey with cancer. So we're hoping that with their story, as well as a clinician who comes to present, that'll have an impact on the audience. And they will take home the message, not only from the survivor, but from the clinician.
That's very interesting. We'll be right back after this break. Welcome back to For the Record. Now, I was talking to Marianne, and she's a breast cancer survivor, that is. When were you first diagnosed, and at what age?
I was first diagnosed in 2004, and I was only 47 then.
47.
Yes.
What stage were you
I
diagnosed
think
with?
it was early stages of stage 2, but because of the early detection, I was lucky.
And how was that cancer initially detected?
Okay, first of all, in the year 2000, I felt a lump above my left breast, so I decided to go to the hospital and get it checked. And I was booked for surgery, but I didn't keep that date till 2003. Then I finally got it out, and was told to go back in January 2004, and was told that I had breast cancer.
How did you feel when you first received the news? What was your state of mind like?
Actually, I thought I was expecting the doctor to tell me that, because during the stage of taking out the lump, he sort of said that there was a little problem there. So when I heard the problem, I thought, just at the back of my mind, I thought it must be a breast cancer. So when he told me in Jan, then I just accepted it and asked him, what's the next step?
And is there like a family history of breast cancer?
Yes, my mother also, she died from breast cancer.
When you found out, how did the family take it?
Well, first of all, they were so sad and disappointed, so I told them not to be too bad. It wasn't too bad. I live, and I'm still here today.
So you have a good family
Yes,
support network?
Yes, my husband is very supportive, and my children as well.
What are the things you believe is needed for someone to survive cancer? Like you said, a good support network. What are the other things that you believe a person needs to have?
It's very important to be positive, stay positive, and be happy.
Positivity and
Yes,
happiness.
I'm a very happy person.
So tell me about your treatment process.
Okay, after there was a week after I got my mastectomy, and then I was told I'll go through chemo, all done here at the CWM, and I had 6 cycles chemotherapy, and I was lucky that my hair didn't fall. It was just the nausea, and I had chemotherapy done here, and all with no expenses.
And were there any other programs or services that were offered to you to help with your treatment?
There was some counseling, but I didn't really know anything about the society then.
Yeah.
But then later on, I got to know. So, and when Belinda asked me to join the society, it was good for me because then I got to know what other women were going through and how they were getting treated.
And what were some of the obstacles during your treatment process?
No,
Lack of information.
yeah. Well, before I had the chemo, they didn't. I wasn't told that what chemo was,
What chemo was it?
and what I was going to go through. But otherwise, it's so good to have the internet, and then you start googling these things, and you get to know more about it.
What message would you like to provide to the women of the community?
Early detection is very important. Once you find something that's not normal with you, it's not only in the breast, or it can be other places. So once you find out something, take yourself to the doctors to get checked.
And this is where the Fiji Cancer Society works closely with women who are going through their treatment process, am I right? Or at some point?
At some point, yes. We have a survivors network,
Yeah.
and we normally call on them to provide the necessary support. And currently we have one survivor who's been very supportive with the women that are journeying through cancer. So it depends. If there is a request, then we're able to refer the patient onto this volunteer or survivor.
And what other ways do you help them during the treatment process?
Besides that, there's transportation services we provide. This allows them to get to and from hospital. Some of them, it's really difficult. When I'm just generalizing this. This is to all cancer patients. It's very difficult for them to put together 70 cents to come. And my understanding is, since we've provided the transport services, the number of patients who are actually coming back for their review, for their clinics, has increased. Women who are coming back for their chemo, that's happening now. Normally they default. The nurse would go out and look for them, but now with transport available to the nurses, they're able to make arrangements for the patients to actually come in for their chemo on time.
And what are some of the other services that you provide apart from transportation?
Okay, we've had to 3 bra and breast prosthetic fittings this year. We work closely with 2 ladies in Sydney. They actually procure through donations from the public in Australia for prosthetic bras and breast prosthetics. So we bring that across and we fit the ladies who have had a mastectomy with bras. So that is given to them free of charge. And we've done that. We've covered Lautoka, we've covered Suva, and we've also taken it out to the north.
That's very interesting. We'll be right back after this break. Welcome back to For the Record. Now, Dr. Munshi, one of the things that I've always wanted to know is what causes breast cancer?
That's a very good question. People might think it's all related to your genetics, etc. But it's good for you to ask me that question because I can tell you that more than 90% of breast cancer is actually sporadic. It doesn't have a genetic component. So there are certain risk factors that are well documented to increase, the likelihood of someone getting a breast cancer. The biggest risk factor, believe it or not, is being female. So yes, breast cancer can happen in males. I know it's, for some of you listeners out there, this might come as a surprise, but yes, breast cancer can happen in men, but it's 100 times more likely to happen in a woman as compared to a man. The second biggest risk factor, I would say, is age. So cancer is, generally speaking, a disease of middle to late age. So the peak age, I would say, is around 60 years. And in saying that, we are seeing cancers in the younger and younger generation. And just the one more sort of big risk factor there is estrogen is a hormone that's produced by the ovaries. And most of the breast cancer that we do see, it is what we call hormone receptor positive. So anything that increases your exposure to this hormone basically potentially, although it might be small, increases your risk of having breast cancer. So what does that mean? It's basically if your period started at a very early age and you had a very late menopause, that means your exposure to estrogen has been long. If you have a child at a very late age, that means your exposure to estrogen has been long. Or if you never have a child.
Just to go back to what you had spoken about with the men and women, men's symptoms are similar to that of women, or do they differ?
Yes, by far the most common symptom or reason a person would present is a lump in the breast. And this is true for a male as for a female. So you're absolutely correct in saying the symptoms are similar.
So if they were to see a lump, would they think it was because of a training exercise or probably going to the gym? How would you encourage men? Is there a stigma associated with that as well?
I guess not so much as a stigma, but the lack of awareness. Absolutely. Because women, I guess, think we are probably immune to getting breast cancer. It's a disease of women. But no, actually, a small percentage of men do get breast cancer, and unfortunately, because of the maybe lack of insight or awareness, or the lack of acknowledgement that they potentially can get it, unfortunately, men present late.
And how many recorded cases have you had in Fiji?
So,
let's say over the past 5 years?
Yeah. So on average, we would see at least 1 or 2 at the max of breast cancer in males. Yeah.
So with women, well, what is the youngest recorded case of breast cancer in the country?
Like I said, it's generally a disease at around 60 years of age. But in saying that, we have seen younger and younger women get breast cancer. Now, I can only talk about my experience, and the youngest patient I saw with breast cancer was 22 years of age. However, because I have many other surgical colleagues, in Fiji, I think the youngest case of breast cancer would have been about around 18 years of age, so someone in their teenage.
You spoke of hormones with women being one of the major factors. Does lifestyle play a factor into it?
Yes, So there's a lot of active research actually going into that. Now, a lot of data is actually based on population-based studies. So, okay, women who have breast cancer, let's see, okay, were they obese, were they sedentary, they are not eating well, etc., etc. And when you look at that sort of population sort of data, then there is some evidence that seems to suggest that there might be increased risk if you are, say, obese, if you smoke, if you're inactive, that your chances of developing a breast cancer is slightly higher. But there's some sort of better research that's going into this field to help identify exactly or address exact issues that you've just asked.
So what would you say would be some of the things that people would do to improve their lifestyle to avoid getting breast cancer or any cancer of the sort?
That's a very good question. I think generally just being healthy. Again, it would not maybe dramatically, but in small steps, lead to a reduced risk of cancer in general. So what I mean by that is eating sort of the right kinds of foods. We shouldn't obviously adopt a so-called Western diet, which unfortunately our people are getting more accustomed to. I think what we used to eat before, what we pulled out of the ground, what we hunted, okay, what we fished out of the water, those wholesome, nutritious, organic foods is what we should be eating. And in saying that, we have become a bit more sedentary over the years. And I think just by increasing our levels of activity, being healthier basically means, to some extent, you are afforded some degree of protection.
And Marianne, has this been some of the things that has helped you with your progress? Healthy living?
Yes.
What are some of the things that you've been doing that have been helping you with your, with keeping cancer at bay or getting rid of it?
The number one is the positiveness. And then I do a lot of walking.
Yeah.
But lately not so much. But I used to be a very sporty person. So walking with my husband and just being happy and eating in moderation.
So a healthy lifestyle, all that plays a great part. And given that, we as Pacific Islanders, we love our food. Love our food. The partnership between the Fiji Cancer Society and the Ministry of Health, how is that going along? Do you have anything in the future that you're doing together?
Well, for us at the Society, we have a planned roadshow scheduled for the 16th to the 20th of October. That's a roadshow around VT level where we will be doing screening as well as awareness. So with the screening, it's breast self-examination as well as
That's
PAPs.
very interesting. We'll touch on that shortly after this, but right now we'll go to a break. Welcome back to For the Record. As I was talking to Belinda, I was asking her more about what the Fiji Cancer Society and the Ministry of Health do together. And you were talking about the roadshow. Would you please elaborate more on that?
Okay, the roadshow is a collaboration with us and the Ministry of Health, and this is scheduled for the 16th to the 20th of October. So we will basically travel around VT level, doing screening as well as awareness. So in regards to screening is just breast self-examination and pap smears with VIA. Did I use that correctly? Yeah. So at the moment we're just finalizing the logistics, and we'll be putting that out in the media next week. So those people around, it's more Tai Levu, Raki.
Coastal areas,
Yeah. We'd like to encourage them to come. When you see the medical bus, just make your way to us.
And you
Get
would
yourself screened, have a little pep talk with the nurse practitioner, and then see if everything's all right.
And you obviously would have the time, dates on you have a Facebook page?
Yes, we'll post that on our Facebook page as well.
And how would you encourage women to come to these clinics?
It's a two-pronged thing. We want them to come, listen to what the clinicians have to say, as well as get themselves tested. So by listening to what is being said, they should be able to tie it together and tie it back to the reason, the whole purpose of the screening, because the message is, early detection saves lives. So it's very important that they get screened. If they feel that there is an abnormality in their body, they need to come and get themselves checked, especially with the breast.
I'm assuming you have a contact person within the different locations around the country.
We will.
And what are they doing to ensure to get the message out for the women within those communities?
For as long as we give them the dates when we're going to be in those communities, then they will just let the communities know and emphasize the importance as to why they need to come and get themselves screened and get more information.
And what have been some of the challenges for both the Ministry of Health and the Fiji Cancer Society in terms of working together and working with other stakeholders?
I guess the biggest it's not. I don't think we have many challenges working together. I think we work together quite well, but I think the biggest challenge we face as a whole is just the health-seeking behavior of our public at large, and I think it's something that probably needs to be said. That unfortunately. Pretty much, I would say almost 100% of the women that do show up with breast cancer would have gone and sought advice somewhere else. Not at just one source, probably 2, 3, 4 different sources. Now, I'm not too sure whether that's a lack of maybe trust in the health system, maybe relying, are we still ingrained a little bit more traditionally into the other traditional forms of medicine, or just that we are generally poor at health-seeking behavior. But I think that's the biggest challenge we have. And as Belinda rightly alluded to, for all the women that we see with stage 4 metastatic non-curable breast cancer, if they had all presented early on in the piece, when the lump was small, when the lump was operable and curable, I think our numbers would look much better in terms of survival rates from breast cancer. I think that's the biggest challenge we face.
And is treatment much more, is it viable now than it was 10 years
Absolutely.
ago?
The treatment for breast
in
cancer...
the country, that is.
Yes. It's evolving worldwide, and that's translating to locally as well. So the main... I'm glad you brought this up, because I think this is... many people would be questioning, what is the treatment for breast cancer? It's not just one thing. It's a whole heap of things done together at the right time to ensure you have the best chances of beating breast cancer. And I will just mention broad brushstrokes as to what it is. Surgery being number one, and then goes hand in hand with chemotherapy. So what is chemotherapy? Is strong medications that are given to patients which help kill off cancer cells that are circulating in the body. The important thing to realize that cancer, anyway, especially breast cancer, starts off in the breast, takes hold, and then it wants to spread to the rest of the body. Now, whilst it's confined to the breast, we can cure it, but once it's left the breast, we cannot cure it. So chemotherapy is very important. The other thing that's important is what I alluded to earlier on, is the hormonal therapy with tamoxifen. Most women would be estrogen receptor positive in terms of their breast cancer. So this is another therapy this is given. And the fourth one is radiotherapy. Now, this is probably the only thing we don't have locally, but there are some efforts to getting it into the country, which would complete the whole package of treating breast cancer in the country.
Now, it is well known that when some women have removed their breast, when the breast is removed, that is, there is a social impact to that. They obviously will suffer some form of stigma, whether it be from a loved one. What kind of services do you provide? This question is posed to the both of you.
Well, for us, we have that bra and breast prosthetic fitting. So we fit them. We give them I should have bought one. We give them the breast prosthetic, which is gel-like, and they fit it in the pocket of the bra. So when they put it on, you can't really tell whether they've had a mastectomy or not. So they look normal. They are normal. They have that balance.
Do you also provide some form of counseling for the husbands?
Not at the moment. We haven't really touched counseling. We've just had a volunteer who's providing that for newly diagnosed patients or patients who have queries. But it's something that for us at the society we'd like to introduce next year to provide that counselling service.
So you outsource your counseling service, or it's just
It's still a work in progress. Yeah. So by next year, that's our target, to have counselling services available for not only the patients but the family members as well.
And what other forms of mental distress do you know that certain patients go through during this time?
Mental distress. I think for some of them, they'd probably be at their wits' end as to where their next meal would come, because most of the patients we assist are those at the lower economic scale. So these are the ones that may need social welfare assistance. They can't have a decent meal when they should be having something good to help them with their treatment. It's always financial for them. So how can they access that service? So we try and work as close as we can with social welfare to assist us.
Thank you for that.
Assist our patients.
Thank you for that, Belinda. Right now we'll go to a break. We'll be back soon. You're watching For the Record. Good evening and welcome to For the Record. Our discussion this evening, Pinktober. Now, I've been interested in, one thing I wanted to know rather, is who have all been involved in the Pinktober campaign?
Okay. We have partners who have actually come on board to support us for this month. So we've got Colgate-Palmolive, we have Tano Group of Hotels, we have Ranjit Garments, we've got New World IGA, Fiji Airways, Fiji Gas, Vodafone, Fiji Dairy, Janty Canvan, and the Banking on Women Network for ANZ Bank. So
pretty much like backing of a lot of business houses, eh?
yes, exactly.
And like, last month you had the biggest morning tea.
Yes.
Is that also something the Fiji Society for Cancer gets involved in?
Yes, the morning tea the Bushels Morning Tea is a multi-buy partnership, and that normally runs till the end of September. However, we have organizations now that are coming back to us and telling us that they'd like to host a Bushels Morning Tea in October. So we allow that, and whatever funds they raise is directed towards that particular program for Bushels Morning Tea.
With just 3 more weeks left for this month, what are some of the other activities that you have coming up apart from the roadshow?
Well, apart from the roadshow as well as the morning teas, there's organizations call and ask for awareness, and that coincides with the morning tea. So with the awareness, they normally request a clinician or a board representative or a survivor to share their experience. So that's where we get our awareness bit. Besides that, we have the media. We'd like to acknowledge all our media partners out there, FBC, Fiji TV, Fiji Sun, Fiji Times, Fiji Village, for allowing us to spread the awareness. These media partners have come on board, and it's just about every day there's always something in the newspaper, on air, in regards to cancer, be it from a survivor's perspective, a clinical perspective, or just what the society is doing.
Now, just to go back a bit on the treatment with breast cancer, one of the things that I was interested in is, do you have like alternative methods? Like other alternative methods? Are there more holistic approaches to the treatment that you provide at CWM?
We provide treatment that's scientifically backed up and what's been shown to work. And what's been shown to work is, as I alluded to, surgery, chemotherapy, radiotherapy, and hormonal therapy. Unfortunately, there's nothing else that you can do to treat breast cancer. Nothing else really works. A lot of so-called treatments might be out there, And unfortunately, the cancer patient is a very gullible, emotionally gullible person. And it's sort of an opportunistic time for wrong information to be fed to them. And
So
God
that-
forbid, they might be enticed to undertake treatments that don't actually work. But what I've told you is we do scientific treatment, and all the 4 big modalities are those that we do and work.
Now, one thing I want to ask,
Yeah.
what is your final message to the public on this year's Pinktober Breast Cancer Awareness Month? Do you have any final message you want to give the public?
My message is, please, if for women and for men, if you have a lump in your breast, if you have any abnormal discharge coming from your breast, if there's anything that you're worried about your breast, please do come and see us in CWM Hospital. Or if you are not in Suva or access to any health facility, please do go and seek your nearest doctor, nurse, or health practitioner. Don't let it fester. We want to detect your disease early.
For you, Belinda?
Adding on to what Dr. Bash has said, sorry, it's Pinktober is not restricted to October. We have there's 12 months in the year, so please don't wait for Pinktober to come around and get yourself tested. Come any time of those months, and if you can't go to your GP, just come across to us at the society along Waimanu Road and see how we can help you. We can assist you with a referral process to oncology or to the breast clinic. We're there. We're there for you. That's basically what it is.
Miriam, would you like to say some final words before we wrap up this evening?
Yeah, I just want to just let everyone just stay positive, and early detection will make a big difference. And please just take yourself to the doctors if you find something abnormal.
Stay positive. I like that. I'd like to thank you all for coming this evening and being a part of this segment For the Record. That was For the Record for the evening. We hope you enjoyed the show and will join us again next Sunday.